It's a very busy day in Council Chamber, I understand, with the budget, so thank you for showing up. My name is Tomislav Svoboda. I'm a physician, a family physician, and public health physician at St. Michael's Hospital. And I'm here today to draw attention to the issue of bike safety and to the need for City Council to get back on the path it left behind by dramatically increasing on-street bike lanes in the city. I'm also releasing an open letter to City Council signed by 22 physicians who work at St. Michael's Hospital who are concerned that Toronto is the only North American city removing bike lanes, and who are calling for adding 400 kilometers of new bike lanes. I'm pleased to welcome my legal counsel, Peter Rosenthal, along with Dr. Ritika Goel, a colleague of mine who also works at St. Michael's Hospital, and Farah Khan, who is representing the Canadian Association of Physicians for the Environment. Tomorrow, I'm scheduled to make an appearance at provincial court to answer mischief charges for peaceful action I took on November 13th, when I sat down on the street as a city crew began work to remove the bike lane on Jarvis Street. For almost 3 years, I used this bike lane to ride between my home in the Annex and St. Michael's Hospital and Seton House, where I work as a researcher and family physician. I made the decision to take this direct action because I felt deeply compelled to protest what I, along with many others, view as an egregious disregard by decision makers for the health and environmental benefits associated with bicycling in general, and bike lanes in particular. Let me review some key facts. The city is 382 kilometers away from meeting the goal adopted in 2001 of creating nearly 500 kilometers of on-street bike lanes by 2011. The city is moving in reverse, removing lanes in both 2012 and 2011, while other major cities invest heavily in on-street bike lanes in 2012. In that year, Montreal built 35 new on-street bicycle lane, 35 kilometers of on-street bicycle lanes. Chicago built 53 new kilometers of on-street bicycle lanes, and New York built 33 kilometers of on-street bicycle lanes. The scientific evidence is strong and growing that bike lanes prevent injuries and save lives. The provincial coroner found in a 2012 report that fatalities can be prevented by on-street bike lanes. The decision to remove the Jarvis Street bike lane was taken by a committee of City Council without any public consultation. The removal cost taxpayers nearly $300,000. Removing the Jarvis Street bike lane was such a bad decision in so many different ways, it had to be protested. It seemed like the city was sending out a message that while bike lanes might be safe to ride in, they're not safe from really bad decision making. As a physician, I have a duty of care for my patients, and by extension, I have a duty of care for my community. Each year in Toronto, over 4 people are killed while bicycling. Last year, there were 6 people killed and more than 1,000 injured. These events are usually called accidents. They could also be described as a failure by the city to protect its residents and to build a healthy city. Active living and active transportation policies are essential urban planning tools to build healthy cities. It is simply wrong to remove bike lanes when so many residents are looking for ways to lead healthy lives. Residents want more bike lanes, a whole lot more, and we must protect the ones we have. In closing, and before I ask my colleagues to say a few words, I'd like to acknowledge the support I've received from Councillors Kristen Wongcam and Mike Layton, each of whom is a champion of cycling in the city. I'd also like to acknowledge the support that I received from folks at Cycle Toronto, where I hope to be contributing with the service hours. And I'll hand it over to
Can we move the microphone?